afternoon, and I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions each Tuesday and Thursday here on the Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions that we've received through the 2nd of September today. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or directly via email at globalhealthinstitute@northwestern.edu. And leading the discussion today is Vinay Derbakula, who is an intern this summer with the Institute. So Vinay, I now turn it over to you.
Thank you, Kristen. So for today, we'll start with some general statistical updates for COVID around the country as well as the area of Illinois or state of Illinois. So to start, the state of Illinois continues to see a gradual increase in the vaccination rate. As of yesterday, September 1st, we've reached a 50.8% fully vaccinated rate. Then we look at around the world, how are other countries doing? And we look at the EU, it shows that around 70% of adults in the EU are eligible people for the vaccine are now vaccinated. And so compare that to the 50.8% Illinois, 51% for this entire country, US. It's a significant increase. And so while the United States continues to see a gradual increase in the vaccination rate, it is nowhere near some other countries as well as the entire European Union. But then looking at the individual COVID statistics, the state of Illinois continues to see a gradual increase in the positivity rate per day. We've reached 4,057 positive cases per day as of August 25th. But again, looking at states like Florida, which have 20,930 positive cases per day, and Texas, which have 16,600 positive cases per day, Illinois continues to be significantly less than these states. Then, in terms of headlines for today, first of all, articles have come out and said that COVID vaccines around the country at several pharmacies are being wasted. And they've said about at least 15.1 million doses of the COVID vaccine since March 1st have been thrown out. Now, Dr. Murphy, this seems like it could be concerning. Is it really?
First of all, with vaccine usage, because of the storage requirements and the multi-use vials that they have, coupled with a very well-known shelf life to the vaccine where it will expire, there are sort of acceptable wastage rates for medicine and for vaccines. Now, in the United States, it's been reported that 0.44% of the doses have been wasted. This is probably a pretty gross underestimate. It's probably more than twice that. It's probably closer to 1 to 5%. But let's put it into some kind of context. Look at COVID vaccine use in France, a very centralized system with everybody's got a doctor, all their medical records are electronic and online, and they know basically what happens to everybody. They've wasted 25% of the AstraZeneca doses, 20% of the Moderna doses, and 7% of the Pfizer doses. If you look at WHO, they haven't collected the wastage rate yet worldwide because there's so few vaccines worldwide. However, they monitor vaccine wastage rates for all the other vaccines that WHO, UNICEF, and everybody are giving out. And that's around 50%. Wow. You have to keep in mind, in a lot of these countries, the cold chain required for some of the vaccines is very unstable, and there's a lot of other challenges involved. But I mean, so you have wastage rates really up to 50%, and that's kind of their average. So some places are worse than others. So what's an acceptable wastage rate? It's never going to be 0%. So far, even if it's 1 or 5%, that's actually in the quote acceptable range.
Okay, that makes sense then. I guess it's not as concerning as it initially looked. But then staying on that topic of vaccines, some new data came out a couple days ago regarding the Moderna and Pfizer vaccine. And the study was done in Belgium, and they found that the Moderna vaccine is up to 50% more or more than double the antibodies compared to Pfizer. Is this concerning? Should people who got the Pfizer shot be concerned about this drastic increase with Moderna?
Well, there's a couple reasons why it's not concerning. Number one is it more important to have 50% more antibody or 50% more disease or less disease? It's really the endpoint. The antibody level is not the endpoint. The endpoint is getting infected, getting severely sick, ending up in the hospital, going into an ICU and dying. That's the endpoint. So there is no difference in those endpoints between the Moderna and the Pfizer. So that's one thing. The other thing is that, remember, antibody levels are important. They're a nice marker of what's going on, but there's a whole other part to the immune system that is out there that they're not measuring. So even if the antibody levels of one vaccine was higher, what about the T cell response? The other parts of the immunity that are important in keeping people healthy. They don't mention anything about that. Then finally, the antibody levels, typically we don't really look so much at the arithmetic difference between the antibody levels. It's usually an exponential increase. So a logarithmic increase is the typical way we look at them, and because that's more biological. So 50% is actually maybe not that big of a deal if you look at it from that perspective. It's not 2 or 3-fold more, for instance, or 10-fold less. That would be significant. So 50%, with all the other caveats I just said, one study done in one country with no difference in overall outcomes, I don't think it's of concern.
Got it. And then one other point to make is just that schools are starting up again. And so especially in the Chicago area, we have seen kids go back, we've seen kids get sick. Is there anything concerning coming out of this end in terms of that you've seen on the immediate start of schools?
Well, I mean, school's barely been back in session, and some schools haven't even started yet.
True.
And here we've had already 26 schools have reported outbreaks. And so there's just so much virus out there. And it just highlights the importance that you want to protect the children, and you want the children not to infect anybody else. Everybody in the family has to be vaccinated that's eligible for a vaccine today. That's the only thing that's going to stop this.
And then just one thing to add would be the fact that because of the continued rise in the COVID positivity rate in the state of Illinois, as well as the Chicago area, Chicago has itself instituted a travel advisory that is expanded to the rest of the United States, saying that people who are unvaccinated must now quarantine for a week prior to their arrival or getting to work in the area.
Yeah, I mean, the pandemic is out of control in the United States right now. That's basically what that's saying.
Yeah.
Again, just yet another reason to increase up the vaccine rates as much as possible.
Yep. Awesome. Well, then now we can move on to our viewer-based questions. We'll start with the first one. So several people, obviously flu season is beginning. And so several people are just wondering, is there an issue taking the flu vaccine with the COVID vaccine? One person had mentioned that normally they don't have any reactions to the flu shot, but they took the flu shot this time around and they got the same reaction they did with the COVID vaccine, which was like chills and dizziness. So is there a link between that? Is it safe to take the two at the same time? What's the deal?
Yeah, so the guidance on this changed on August 9th of this year, where before they were saying keep them apart, wait till all your symptoms are gone. Most people were waiting 2 weeks. And then after looking at the whole safety profile of the COVID vaccines and the flu vaccines that have been around for a long time, although they're different every year, CDC guidance is that you can take them all at the same time. Because from a public health perspective, if you tell somebody, oh, yes, I'm giving you your flu shot today, come back in 2 weeks for the COVID vaccine. Well, first of all, which one should you take, the COVID or the flu? They're both important. And then, how many people don't show up in 2 weeks? There's a significant portion of people don't show up. Yeah, they get busy, they forget about it. So from a public health perspective, it's better to do it all at the same time. So they're saying, just take it all together. Now, this person normally tolerated the flu vaccine, and this year didn't. Well, remember, it is a different vaccine every year for the flu. So
Right.
that's one. So you can't say just because you didn't have a reaction last year, you're going to have one this year. You can't say that. The other thing is, with all the vaccines people are taking for COVID, perhaps the immune system is a little bit more revved up and you're having more of a response. That's also possible. All that's just possible. I'm not saying that that's actually what happened, but it's not important. It's not a severe reaction, and whatever symptoms you have are going to go away in a day or two.
Got it. And then building off of that, let's say someone is fully vaccinated, has COVID symptoms, and then takes a PCR test and a rapid test. The rapid test comes back positive, but the PCR test comes back negative. What should they trust? And which one do you think would be the right indicator for?
Well, the problem with the rapid tests is they're good in that they're rapid, but they are not as good as the PCR tests or the other molecular tests besides the PCR.
Right.
So PCR basically is the standard to make or break the diagnosis. So in this case, even though the person had symptoms and the PCR is negative, that's a negative test. That's considered a negative test. Now, say the person had a loss of smell or taste, because that is a very specific sign for COVID. You typically don't lose smell or taste, with other respiratory infections. It's reported, but it's really low. So in that case, I would say, maybe the specimen wasn't good or something. I mean, in the worst case, I would just repeat the molecular test, repeat the PCR test if you did lose smell or taste. But otherwise, I would say go with the PCR.
Got it. Makes sense. And then building off of that, several people were just wondering, and then this question has been answered a few times, but it's just, a common concern that gets regenerated every time. And it's just that, is there a need if someone wants their vaccine to switch to the Moderna booster? Are they really ultimately the same thing? What is kind of the protocol for getting that booster? And if someone wanted to switch, what would they do?
Well, there's been really no good study showing that switching from one vaccine to another for the booster is good or bad for you. The guidance is to try to get the vaccine that you started with. But also the guidance says it's better to get the booster if you're eligible for a booster, even if you have to take another mRNA vaccine. In other words, you got the Moderna, now you can't find the Moderna or in your neighborhood or whatever, but you have the Pfizer one. It's better to take one of them, even if it's a different one than you started with, than not take any, then wait and see if you could find the one that you started with.
Right. Makes sense. And then some people obviously have severe reactions to COVID. And one person was wondering, they had actually had a lung clot when they had COVID in January, and they were in the hospital for 23 days. And they got the Pfizer vaccine, so they were just wondering, would they still need the booster in October?
Absolutely, yeah. So if they were that sick, they probably got a good antibody response themselves. The sicker the people are, the higher the antibody levels that they get. Matter of fact, if you have mild disease, just have some sniffles, whatever, the antibody levels drop off very quickly. But with the severe disease, they have longer and better, but that they still are not as good as if you have the vaccine. And if you take the vaccine after severe disease, like this person did, and then get a booster, you're probably going to have higher levels than most people. So you'll be even more protected.
Got it. And then another interesting question gets brought up. Is there a mandate for PCR testing for all patients that are admitted to the hospital? Several people were just concerned that their hospitals don't do it. And so it's possible that patients get admitted, but then don't, maybe test positive, but they're kind of exposing other patients. So then causes maybe minor outbreaks. So people were just wondering, is there a mandate? And if not, what are the precautions the hospitals are doing to make sure that outbreaks don't happen?
Well, all the hospitals I'm aware of do mandate it. But I believe, and somebody can correct me if I'm wrong, that it's not actually a mandate that every person coming in the hospital get a vaccine. However, many hospitals do. The lines of people at the place where our patients go for testing are full of people getting the test before the pre-op procedure. They have rapid machines in various places in the hospital to test people quickly, molecular tests that can be done in 15 to 60 minutes. There's all sorts of places where they are used because those people can really spread it around in the healthcare setting, even though everybody's wearing masks. So I think it's very important, it's really essential that people coming in the hospital get tested.
Yeah, definitely. And then obviously news of the new COVID variant, the C12 variant that was detected in South Africa, has kind of grown over the last couple of days. And so while there's little information, is there anything that the CDC or any official health sources are saying that we should be concerned about this variant, or is it kind of main thing we should be focusing on is the Delta?
Delta still is the one we have to worry about. And even in the places where this new C12 variant have showed up, it hasn't been taking over the Delta. There's been relatively few cases. So technically it's not even a variant of concern or variant of interest at this particular time, but of course people are watching it. This variant has many, many mutations. And sometimes if the virus mutates too much, it actually can get weaker. So, you know, it remains to be seen, but believe me, it's on the watch list.
Got it. And then our last question for you today just have to do with the antibodies that we were talking about earlier. And so we're just, some people were just wondering, is there a specific number or rate at which the antibodies are declining over time? At which point then would they have to worry about a booster once they know their antibodies are at a certain point? Or is it just that the booster has a certain timetable, but the antibodies kind of decline at different rates for everybody?
Well, that's a very difficult question to answer. There have been some recent studies, one reported in the New England Journal of Medicine, one of our top medical journals, that show that looking at 3 of the different kind of antibody levels over time, there is a slow but gradual decline in the antibody levels. Now remember, antibody levels are only part of the response, part of the protection you have. You have another big part. However, you know, we're seeing a lot more breakthrough cases now with this Delta. You know, it used to be 95% protective against infection. Now, you know, that's dropped down to 70%.
Yeah.
So people are concerned and they're using the antibody levels. And these are the specific laboratory ones. These are not the commercial ones that you can just order. So that's another point of confusion. But they're looking at the antibody level as just kind of a marker of all the things in all the parts of the immune system in the immunologic response. And that's why about 6 weeks ago, the CEO of Pfizer said, hey, you're going to need a booster because they're watching these antibody levels continue to drop. It's not precipitous, but it's kind of slow and steady. And it's not unusual with vaccines to have to take a booster, whether it's at 1 year, 6 months, or whatever. So, you know, it has this need for the booster has been just, the messaging has been really confusing. Right. Because first you have the CEO of Pfizer saying everybody needs a booster. And then you have the pushback from CDC and the NIH saying, no, we don't have any evidence that it's not working anymore. Then all of a sudden, a couple of weeks later, say, oh yeah, you need a booster at 8 months. And then a week later, you say, well, you know, maybe you should take it at 6 months. And then just a couple of days ago, they said, oh, no, it really should just be 8 months. Unfortunate. So, you know, you need a booster. We don't know the optimal time. But what we want to do, or what the goal, I think the goal here is that you want to be ahead of the time when they say, oh, there's more people with severe disease who've been vaccinated. Right. We don't want to wait and count the increased number of patients in the hospital and ICU and deaths from COVID in vaccinated people.
Yep.
We want to avoid that. And if it's giving another vaccine dosage, okay, that's what we're going to do. So I think that's the yin and yang here with, do you get a booster or don't you get a booster? And is it 6 months or 8 months? There's probably no magical time.
Right.
But it's somewhere in that particular range. And we know the vaccines are safe. And I think and it's expected that the FDA is going to make the recommendation on the booster dose sometime in the very near future, like in the next week or two, about who's going to get it. And I think it's going to be like everybody is going to get it. Now, this caused a big ruckus in the FDA recently. You may have heard two of the top leaders, one who had been at the FDA for 32 years, Marian Gruber, and her deputy, Phil Krause, I think his name is, have resigned from the FDA because they wanted to, they were unhappy with the fact that all this stuff about boosters was being talked about in the press by the CDC, the NIH, and the White House, and it wasn't coming from the FDA. Yeah. Even though their boss was part of the discussions. But, it is a pandemic. And sometimes you just have to make very important public health decisions based on the best available information and what they think is safe for the patients. These vaccines are very safe. And, like I said before, we don't want to wait until the number of hospitalizations increase or the number of people dying who are vaccinated increases. Right. Other countries have made this decision already. Several in Europe and in Israel also, they're giving the vaccines. Some of them are giving them just to people over 60, or if they have underlying diseases. Some are giving them to everybody. It's kind of all over the place. The countries can do what they want. Right. But this is not going to be an unusual thing. Getting a booster is not that surprising. And the question is, maybe we only have to give a half a dose. Sometimes you don't have to give the full dose. But these are questions we don't know. But these are questions that will be figured out ultimately. And we will figure out the optimal schedule for this in the future. But until then, we've got to go with the information at hand and make the best choice based on that.
Fantastic. Well, those are all the questions we have for today. Thank you so much, Dr. Murphy, for all your help. And we'll see you next Tuesday.
Okay. And WGN tomorrow.
And WGN tomorrow.
Okay, great. Thank you for your name.